Yesterday, we came one step closer to vaccines being approved for children between the ages of 5 and 11.
An FDA panel gave the Pfizer version the stamp of approval, passing it on to the broader FDA and then later to the CDC.
13 on your side's Charlie Ticker spoke with the state's new chief health executive, appearing for the first time with 13 on your side. Charlie joins us now live in studio. Charlie.
Hey, Dr. Natasha Bagdasarian stepped into a crisis, but it is one she hopes to end on her watch, and added protection for hundreds of thousands of Michigan kids, she says, does feel like a step in the right direction.
We are extremely excited about the availability of this vaccine.
That's because it's a key component of the fight to curb COVID, according to the state's new top doc.
This new vaccine availability for those age 5 to 11 opens up protection for an age group that had been completely unvaccinated.
In Michigan, that age group accounts for 825,000 currently unvaccinated residents. Dr. Natasha Bagdasarian tells me the state put in an order for 287,000 doses right out of the gate as part of its first allotment.
We've already got providers who are pre-booking vaccine doses. We'll have about 4,000 vaccine providers around the state. I think that things will move fast once we get that final approval.
The vaccine is safe, and we're encouraging families to consider it.
An effort that might depend in part on the schools themselves. Grand Rapids Public Schools Director of Health Services Kim Barron coordinating the district's approach with county health officials when it comes to next steps.
We are, again, just going to take their lead on what assistance they need from us, whether it's facilities or personnel. Encourage as many families to consider vaccinating their children.
But that's increasingly a bit of a sore spot. Once mundane school board meetings turned hotbeds of COVID controversies, stoking protests, even death threats on the national level. Grand Rapids Public this week launching a series of informational panel discussions geared to curb vaccine hesitancy. As always, says Barron, their work can serve as a resource for parents with questions.
Because it will mean a lot more students can avoid having to quarantine and less severe illness, less hospitalizations, all of those benefits.
Unlike that choppy, chaotic first rollout, getting shots into the right hands now, says Bagdasarian, shouldn't be a problem, despite that national supply chain bottleneck.
If there is so much demand that it outpaces our supply, I think that's one of the best problems we could have. We're really excited to have this vaccine availability soon and to move forward with the next step of ending this pandemic.
The supply thus far, of course, has far outstripped demand. She did also, in the spirit of the season, urge families to get booked for those flu shots to avoid the other nasty respiratory illness out there as we get closer to winter. I did reach out to many of the school districts in our viewing area this morning. Many have gotten back to me in terms of any discussion of hosting future vaccine clinics themselves, how they can contribute, etc. That will be up on 13onyourside.com shortly as a resource for mom and dad. And we are going to keep adding those responses just as soon as we receive them.